Welcome to Dental Nachos TV. I am here with the awesome Dr. Sean Land. He's going to share with us the benefits of placing implants as a new dentist. I'm going to introduce him in just a few minutes, but we have a few previews, few things to share. If you would like a C course on faster crown prep from the amazing Dr. Michael Frazis of our sponsor, Ripe Global, text crown to 215-543-6454. This video is truly awesome. Michael goes through every step from prep to scan or impression to insert, how you can be more efficient. If you're looking to hire an associate, Dentist Job Connect is here to help. Just text hire to 215-798-9897 or visit us at dentistjobconnect.com. Also, you cannot create the most beautiful emergence profile the world has ever seen. You cannot do a full arch implant case. You cannot do a class 2 composite that makes you want to cry inside without a job. So if you're looking for a job, text job to 215-798-9897 or visit us at dentistjobconnect.com. And everything we do is to help dentists learn, laugh, and feel less alone, help them increase success and decrease stress. We put together a real dentisting world survival guide from Dental Nachos and Dentist Job Connect. If you'd like to download it for free, just text survive to 215-543-6454. Now, I want to welcome my special guests. We got people coming in on Zoom. I know we're on Facebook Live. Dr. Sean Land. Sean, thanks so much for being here today. But before we get into your dentisting self, tell us about your real person self. What are you doing on break here? Are you on break? Are you working today? Tell us about your Sean Land non-dentist life.
Well, thanks for having me on. It's been I've been following you for a while, so it's just kind of cool, full circle to come back and be on here with you. So thanks for having me.
Oh, my pleasure.
Yeah, I'm actually back at my parents' house in Florida, just hanging out and enjoying some time with them, and you go to the beach and stuff again. So I actually have my dog with me too. Brought him this time down because I drove down. So it's
What
been
kind of
nice
dog do you
having
have?
him.
What kind of dog is it?
It's a mini golden doodle. It's actually my girlfriend's dog, but he's also my dog too now.
Oh, nice. What's the dog's name?
Clyde.
Yeah, we got Tilly from Philly. She is 39 pounds. So I don't know if she's a medium.
Philly?
Medium golden doodle Tilly, but she's she's like 38 pounds. Yeah, they're great.
Oh, nice.
I had a golden retriever growing up there. I feel like the golden doodle always is like they just drank espresso or coffee. They kind of got that poodle energy to them at times, but they are great.
Oh yeah, I love them.
Great breed. So we're going to talk about a lot of things, but let's just start with your story. Tell us where you went to dental school, what you did afterwards, what year you graduated. Orient ourselves as to the Sean Land story for dentistry.
Yeah, so really quick synopsis. There really isn't much so far because I'm pretty fresh, but graduated 2020 from the University of Florida. And right after that, I went straight into the Air Force. I did a 2-year scholarship with them. So total, I was in there for 3 years. My first year, I did an AGD, which was one of the best things I've ever done for myself, my career so far. And then after that, I served up my my last 2 years of my commitment in Georgia, and now right after that, I linked up with Shared Practices Group, and that's kind of where my journey is beginning now. So
I love this. I always like to kind of interject. I always say interject with good ideas, not interrupt. I tell my wife, I tell her to believe that. And I want to interject with, we talk about the AGD a lot in GPR. I am 46 years old. I did a multi-year GPR 2002 to 2005. I just interviewed Dr. Ben Kakos, one of the top coaches for the DSI, an amazing dentist in Louisiana. He said his biggest regret was not doing a GPR. And when I asked him why, he said, because I would have accelerated my career. I would have learned things faster. I spent a lot of money and time trying to figure out myself. So my goal is to help people who are still in the help phase. So if a 50-year-old dentist yells out, I didn't need a GPR back in the 1980s, they're past the time, right? I'm looking to help people who are in dental school, maybe even someone who's struggling and go back and do an AGD or GPR. You've described it in a way a lot of dentists describe it. Why was your AGD one of the best decisions you ever made?
One of the reasons I actually considered the Air Force in general was that because I had met a lot of dentists, Air Force trained dentists that went to the AGD, and some of them were even like, yeah, it was required. I didn't really want to do it. But then after I came out, I was like, I'm so glad I did it. I don't think all AGDs and GPRs are created equal, just like, with anything. So I think in general, it is, if you like, dental schools will prepare you for fundamentals of basic, like of bread and butter, right? Like the fundamentals, like
Yeah.
basics, unfortunately nowadays, right? That's just the reality of it. And if, you know, if that's all you want to do, if someone bread and butter is all they want to do, that's fine. You know, I have friends that are killing it just doing bread and butter. However, if you do have any kind of inkling for doing more than just the bread and butter stuff, I do think going to a good AGD or GPR program is such a I mean, it's only 1 year of your life, you know,
Yeah.
1 year of your life. Um, and I mean, you're getting paid not a lot, but you're getting paid to get all these experiences. And then more than that, if you go to a good program, you can really get a good even if you don't like doing ortho or endo or blah blah blah, you get to be immersed in those worlds so that you can treatment plan better as a
Yeah.
general dentist and make better referrals. Like I had some co-residents who all they wanted to do was ortho. They didn't really like the surgery stuff, but they're glad they did because now they know what to do in certain cases or who to pass the patient on to better.
I
Um,
love that shares, and I'll add to it is that life is very long, your career's long. That one magical year, it's not whether you did 20 crowns in dental school or 40 crowns. It's about your clinical competence, your communication confidence, and really just growth as a professional. I think the dental school process is just totally nacho nuts with, different instructors, different clinics, do this here. So one instructor says it this way, one does it. For you to get feedback from bigger, stronger dentists for a full year that are dedicated to teaching you, it's just truly magical. And I'll add that one of our Job Connect dentists has a job where he placed, he did an AGD, placed over 30 implants, and now he's doing that in his associateship, placing implants. And he's working with a newly graduated D4 who's amazing in his enthusiasm, but he's only producing about 30 grand a month because that bread and butter, the reality, Sean, is we don't need as much bread and butter. I'm guessing the way you look, you don't eat a ton of bread and butter. Do you put a big loaf of bread on the table every night, Sean, and butter when you guys come home and have dinner, you and your girlfriend? Right. So we cliche, we say bread and butter stuff, but if you think about it, the analogy fits. We don't eat as much bread and butter. So bread and butter dentistry is not going to be needed less frequently. So adding in, like you said, ortho, extractions, implants is so great. So then you do the AGD. Now you do your 2-year commitment to the Air Force. Tell us about your clinical life with that. What were you doing? Were you treating the other Air Force people in the Air Force, regular patients?
Yeah, so in residency, we had the benefit of treating retirees as well. So we got the older patient population, a lot more perio surgery and stuff like that. Um, and we got sedation trained. But after the Air Force, it was mainly active duty guys and gals. So, 20s, 30s, generally very healthy. So not as much perio surgery, still got to do some. But I mean, tons of thirds. The one thing I didn't like about the Air Force was that they don't let 1 year AGD trained dentists place implants. They let you place them with direct supervision, but they don't let you get credential to place them by yourself, which is kind of where my interest was lying. So look, I did go to so it was like a 2-week program with the PROS program that they have in San Antonio. It was an implant, what they call implant short course. So we spent 2 weeks observing, learning the prosthetics and all of that, and treating some patients as well. So that was a great experience for me. But as far as placing implants in after AGD, didn't place a single one. Yeah,
So
just
that's why I'm excited here. I'll kind of share since we've done some similar things. I did 4 implants in my first year of my GPR, 50 in my chief residency year, and 100 in my fellowship year. Because when I first placed an implant, I said, this is what I like. It's predictable. There's no contacts. Nobody complains about the color. It's really just a reverse extraction. And one of the things I'll ask you, and you kind of, make our audience aware, how did your extraction training, your surgery training, how necessary is that to really being able to do dental implants? And is that really what was able to make you do it with confidence, even if you hadn't placed too many in your residency?
yeah. I mean, and that's I mean, I've placed 3 implants total in the last 3 years in the Air Force, right? And then my first case, actually, one of my first cases when I started working with Dr. Tolbert, who's owns the office in Atlanta. Shout out Dr. T.
Yeah.
I did a full arch case, and it's not to say I went in there, cowboying. I'm very, very careful at what I do. And that's one of the things that was instilled in me in the AGD was, I was trained by all specialists, and my perio and oral surgeon attending, mainly were the ones because that was my interest. They told us, listen, I want you to do everything I can do. Obviously not all the oral surgery, trauma stuff, but everything in the dental alveolar world we want you to do, because you're going to be the only guy or gal that's at these bases that can do them if they don't have a specialist. So we want you to be able to do it. However, if you're going to do it, you have to do it right, and you have to do it the same way we do it. So the way that you get there is to read the same things we read and learn the same things we learn, and get the same reps and do the reps to the quality that we do them at. So that was something that they really, really harped on. And so during my 3 years, I just really, really focused on the fundamentals of surgical principles, clean flap, getting really, really comfortable picking up a handpiece and sectioning teeth, taking them out, getting really comfortable troughing. All those things can transfer over. And I'll even say cutting good crown preps with good margins also transfers over. I did a really, really fun case with Dr. Tolbert, where we had a deeply impacted mandibular canine, and we were supposed to do a implant fix full arch on the lower. And so when we went in there, I had never done a coronectomy on a deeply impacted canine before. However, the same exact hand skills that I've picked up from doing molar endo, from cutting good crown preps, from sectioning normal molars, they all came into play. And we were able to decoronate that canine, remove all the enamel comfortably, and place those implants without complications.
I'm glad you said that. I mean, because what you're just to reinforce some things you're saying. One, you learned systems. One, you learned how to be responsible. One, you learned from specialists how to troubleshoot things. I think one of the things that really is important, because being a dentist is so difficult, is knowing what to do right, but also know what to do when things go sideways, because you're often alone in the operatory. We have a crown prep course by this amazing Dr. Michael Frazis from Ripe Global. And let's say you're not going to do a lot of crown preps. Why would you benefit from watching this, Sean? Because he literally walks through every step and how to be more efficient and get good results. And that is the name of the game: increase efficiency, good results plus efficiency. Because I don't know about your patient, Sean, but none of them beg to stay in the chair longer. None of them say, I hope this lasts longer. I'll share that as a chief resident in the residency program, I did a full arch all on 6 implant case in 2004. I did it all by myself. It took 9 hours. Okay. I had to remount the denture, put the rubber dam on, all of those things. And now we've done things where those procedures that time can be cut into a third, right? Where you can, get the patient out of the chair quicker with better results. So I think that's so key. I'm glad you shared that. Also, if my team can put this on Instagram Live, this next part, great. If you can hold your phone up, because I really want to highlight a few things about Tyler. So I think I was saying his name wrong. I apologize, Tyler. His last name, not his first name. But Tyler Tobert was a dental student, and I did my first implant, Sean. And I had 2 dental student spots, Tyler and Rohit Singla took him. He came from Medical College of Georgia, stayed in Philly, paid, I think the course for everyone else was like $3,000, and I just charged the dental students $500. And they couldn't obviously place an implant on a person because they didn't have a license, but they were able to assist. And that was his start to doing it. And would you tell dental students watching this, it's never too early to start paying attention to really, really good stuff?
Yeah, and that's something that I was like amazed when I talked to Dr. Tolbert, and that he started taking courses in dental school, because that's something that didn't really cross my mind, because I was like, well, just I had also the Air Force coming up after that too, so I wasn't really thinking about it. But I was so impressed that I was like, wow, like, yeah, if I didn't have the Air Force, like, that's something I definitely would have started doing.
Yeah, and just put yourself in great places with great dentists
Yeah.
who want to teach you. And I want to tell you, it's kind of it's just like babies in real life. Everybody likes to help you when you're a dental student. Something's weird, right? You could be a 3rd-year dental student and people are like, you can come for $5. We'll buy you food and drinks for this. Then you're like 3 years out of school, like, you're just one of us now. We don't want to be so nice to you. And I say it jokingly. Of course, we're still nice, but just leverage like, hey, I'm a dental student or resident. What's the best deal I can get? How can I get involved? I'll come and assist, because that's what Tyler did back then. And he literally got to watch a perioprostodontist, Dr. Alex Cho, suture as a dental student. And those are just transformative experiences. So shout out to Tyler. Now tell us about the shared, so you leave the Air Force. Tell us about shared practices. I know those guys well. George and I did a book back in the day. I've been friends with Tyler for a long time, but tell us your unique practice model or how you became involved with them?
So I guess to start that, I really started this journey, I guess, back in the Air Force again, where I really knew that, after residency, I was like, yeah, surgery is definitely dental alveolar surgery is what I want to do. Pretty much, I started preparing myself a lot during my time in the Air Force, reading books, reading lit. I took a CE course, zero bone loss concepts. Huge. I mean, if you're thinking implants, you definitely need to take that course and read that book. Um, but pretty much just preparing, my life after the Air Force to hit the ground running as much as I could. I think 6 months, or no, about 7 months before I got out, I got, these denture implant practices, reached out to Tyler, started shadowing, or set up a shadowing date with him. We got along. We talked about uh, what the job would look like. And can you hear me?
Yeah, doing great.
Okay. Yeah, what the job would look like, and we got along really well. And yeah, kind of, after I left, he was like, "Yeah, what do you think about starting practice with us?" And I said, "Well, that sounds pretty great."
That's awesome. And tell me, just for people who don't know, the concept of general dentist running whether we're going to call it an implant center, something that focuses on just extractions. Tell us what you don't do. You don't do class twos, right? Or do you do class twos?
So yeah, my practice is currently just focused on implants, mainly full arch implant rehabilitation. Um, so there's not a lot of, or at all, general dentistry. I think the
No
closest thing we do.
hygiene, no class twos, right? Nothing like
Mhm.
that.
Yeah, yeah, which is kind of ideal for what I wanted to do. I kind of imagined I would be doing this maybe in 5 or 10 years, but luckily this practice model, it really came. I think it's really based on the Foundry AGD program, where they trade their dentists to do a lot of the Malo style all on X or full arch implant rehab type procedures. So that's kind of where the model is based.
And one of the things that I love you sharing this. So now you're running this implant center, Dr. Sean's House of Implants and Nachos. Ask if they can change it to that name if you don't mind. But you have shared practices as a guide, but you're in this office by yourself. Tell us, how are you marketing for these cases? What are you guys doing to bring in patients that need this service?
So I don't control the marketing myself, but I know we do a lot of like your standard Facebook, Instagram, your social medias, good old radio, TV, all those kind of things. And I would say the thing about marketing for a full arch type practice is that you need to spend a lot on it. It's an exorbitant amount of money per month that I know is spent on marketing. And that's partly because it's not a traditional model where I'm not a specialist, so I'm not. Well, I am planning on going around just to meet the dentist around my area and seeing who I can refer to for, if a patient comes to me, they don't need a full arch implant rehab yet. I want to be able to partner with some dentists that are able to do good comprehensive work, and also just to, know my neighbors. I know
Yeah.
there's a lot of people starting to do this now, and some people might have that, the scarcity mindset, and I want to find out, well, one, just who those people are, but also want to be able to grow and learn from other dentists that are more growth minded in my area, who are not so
I love it. I mean,
scarcity minded.
uh, we have such parallel things. So one thing my team can share, someone's asking about the book, which I think is it Modern Bone Loss Concepts or Zero Bone Loss
Uh,
Concepts?
yeah, Zero Bone Loss Concepts by Thomas and Chavigas. I can if you get with me after, I
But
can
I
send
want
you a
my
whole.
team to put in, we have the Dental Nacho Supreme CE platform, Sean, where I have hours and hours of courses on everything. We have so much on dental implants because I partner with Dr. Rob Slough. Dr. Rob Slough is a surgical prosthodontist. He took over for Tom Bolshe, one of the most famous implant dentists ever, who helped invent the immediate load implant cases. And he will walk people through how to plan these cases, how to do aesthetics for these cases. So we have a deal on that. My team can share it for dental students. It's under $25. For regular dentists, it's under $79. Because what's key is what I do with him, Sean, is I just go around to other dentists and we have host a CE course, and we just say, hey, come and learn from us. If we can help you, great. If you take this back to your practice, great. Because when you're just abundance minded with the people in your area, they go, oh, those people do that thing. My patient needs that thing. I'm going to share, refer to them. And I think I really compliment you for doing that. So everything from Facebook to basically face to face. And I'll add in, I think we talked about this on a pre-call. We've had really good success with direct mail, just old fashioned direct mail. It looks like it looks like an educational brochure. It's been phenomenal with getting us implant cases as well. So that's
Yeah,
a mark.
I'm
Now,
interested in trying that. Yeah.
any question, you are so generous to share all of your knowledge. You don't have, if any question becomes too either personal or specific, you just talk about it in an evergreen way or a general way. But clinical skills are one part of doing this, right? But what about how do you financially prepare yourself or get yourself ready to run a practice just 3 years out of dental school?
That honestly has been the hardest part is the leadership part. I did have some experience in the military, because I had to, I had to wear the captain, every day, and there's people, young people that were kind of they look up to you. First of all, because you're like an officer or whatever, but the
Yeah.
second of all, because you're also a dentist and they're working with you and stuff. So I think I did read like one or two leadership books. Did they? I think a lot of the leadership books, right? They kind of and the self-help books, they all really say kind of very similar things. But I think it's remembering those things when you're in the heat of the moment and needing to have a crucial conversation or something like that, and putting it into practice. It's just like dentistry, getting more reps with those crucial conversations, those difficult conversations. But reading books, I would say, is a good way to start. Leadership books,
I
just to
agree
get
with
your
you.
brain
I also
flowing
share
on
this.
those
This
things.
is a really good take home, and you'll remember this on Tuesday or next time you're in crying inside. People are much more difficult to troubleshoot than procedures. People
Oh,
are
yeah.
more difficult. I was placing a implant once, number 31, like when I was 5 years out of my program, and for whatever reason, the implant just sunk like 10 millimeters beneath the osteotomy, some sort of marrow space, and I was just like, I had that feeling in my stomach, but I just took it out like a root tip, right? And I said to the patient, today's not the day to get this implant. And I knew how to troubleshoot it, right? Even though it was very anxiety, I'm just going to take this out like a root tip. But then you have people, whether it's your team and things happen out of your control. And you just have to give yourself grace, but also just be very resilient in creating a culture of expectations, standards, protocols, and systems. And I just think that's the most difficult part of running a dental practice. I always say, Sean, it's like running a circus where the animals don't try to eat you, just slowly annoy you to death as a practice owner. And I say it in the most collaborative way because I've worked in restaurants, I've been played sports. It's stressful to be in a dental practice, right? What you do with full arch cases actually is pretty amazing because there is a happy ending to it, right? There's a happy ending to it. But a lot of what we do, patients don't want to be there or pay for it. So you have to be cognizant of that with your team. So I applaud you for reading those books. Let's go to next to when you deal with complications, things that don't go well as expected, right? Maybe sometimes it's patients who have unrealistic expectations. How do you handle those from whether it's clinical or customer service?
Yeah, that's a really good question because like that's again, you're dealing with the person, right? That's the toughest part of the job. And my kind of approach is well, it's we recently had a new doctor retreat where I'll shout out Dr. Stephen Vorholt here, where he kind of really outlined it very well in different steps. I can't for the life of me remember the exact steps, but in general, my approach is to address it, very directly. Don't like jump around. Just yeah, okay. Hey, I have some unfortunate news. I saw this on your X-ray, or I'm seeing this clinically, and you just state it very objectively. Being direct, but showing that you still care about them. It appears that you have this XYZ, and that this can happen, with this kind of treatment, like we talked about. Hopefully, you talked about it before the actual procedure. So it doesn't seem like an excuse, like you properly had those conversations with the patient before. And then another important part of that conversation is establishing yourself as an expert, right? And especially as a young dentist that's performing these more advanced procedures, that can be a tough thing to do. So finding that self-confidence and being like, no, I am the expert. Although I'm relatively new at this, I have studied a lot and I know, how to deal with these things. So presenting your way as such can help the patient feel more comfortable around you as well. So you can say things like, I've seen this in residency, or I've seen this in books. In my experience, this is normal, you know, to see, and this is how we're going to deal with it. Um, and then giving a opportunity for them to say, okay, after we discussed, we just talked about a lot. It's a lot of technical jargon. Do you have any questions for me?
I love that. There's a great talking points. There are some things I can share because I'm the older dentist on this call and I deal with this a lot because a few things is some talking points people can share. It's always about these little talking points that I say E squared equals MC. Empathy and enthusiasm equals more connectivity with your patients. So I show empathy and enthusiasm. So some things I share is let's figure out the next best steps together. Let's figure out the next best steps together. Use a case from my life. 2005, I did this all on what would be considered an all on X upper and lower for someone who hadn't been to the dentist in 30 years. 8 years later, the implants were showing bone shrinkage. One thing I share, Sean, implants don't fail. They just retire and need to be replaced. Implants do not fail. They just retire and need to be replaced. So we
Like
had a
that.
classic situation where there was bone shrinkage around implants. So I said, let's transition this. Let's take this from something that stays in your mouth all the time, Mark, to something that snaps in and out, something that's easier to clean. You've had this for almost a decade, but cleaning a fixed implant case is like trying to clean underneath your couch with one of those Dysons. Removable implant cases for his part in life, he's in his late 70s at this time, was reasonable. So I was on his side. We figured it out together. Implants had to be removed. Transitions had to happen. But I just think dental school trains us in this really toxic way that everything's supposed to go perfectly all the time. And it just doesn't. And the other thing I'll share is for people watching, we're going to show this on demand. Sean, just to be realistic, do your new patient consults, when they come in to see you, are they people who've taken really good care of their teeth over their life?
No, I mean,
Most
in
of the
general,
time.
they're the dental avoidant, right? Yeah.
Yes. So they have behaved in a way that has caused this most of the time. And you can be graceful and you can be empathetic, but they have behaved in a way. The guy I saw hadn't seen the dentist in 30 years. I was 28 when I did the case, Sean. He had not seen the dentist longer than I had been alive. So he did that, not me, right? So then these are the people who also may behave by not taking care of it, not coming back for recalls. So it's so key that you're clear with them that the way they take care of this, like I was to say, like a fancy sports car, you wouldn't not take your car in if you saw a check engine light. And I just think it's something anyone who gets into full arch implant cases, especially, or any type of full arch dentistry, has to remember that the patients are there for a reason and managing their behavior can be out of your control. But documenting protocols are so key. I mean, one of the hygienists asked, Sean, what is the, let's say someone does a full arch upper and lower case, they love it, take all the pictures, they're happy. What's their maintenance schedule like after that?
So I always suggest to my patients, hey, you need to go see a general practitioner about 2 times a year, just like your normal. You know, this is not a free ticket to never seeing a dentist
Yeah.
again. So 2 times a year, and having the prosthesis, you know, removed at those times to check for screw loosening and stuff like that. But one thing that I really do to try to hone that in is during the healing phase, like the first 3 weeks where they can't use the water pick and whatnot, their temper is going to be gross. And so I kind of capitalize on that. And when I take that off and they taste all the nastiness, I show them the underside of it. I'm like, look,
Yeah.
this is what can happen if you don't go to the dentist still. And they're like, oh my God, I didn't even think all that would be under there. I'm like, yeah, that's why. You know, and then after that, I mean, I'm hoping that kind of experience would make them, you know, kick them in the butt, at least go see them, you know, twice a year.
Like that. Some more questions. Doing great, Sean. I want to make sure our audience is clear. So you do 3 implants in your Air Force, but you have a lot of surgery experience. Now you're placing 15 to 20 implants a month. You did that 2-week course in San Antonio. Are you also getting training from the other shared uh, dentists from shared practices? Tyler, kind of remind us of how you got in this training to get up to the 15 to 20 a month.
Yeah, so in the I mean in the Air Force, really I came from a standpoint of, well, I'm not being paid a lot, and but I have a lot of time. And so I couldn't go out, well, I had the time to go take off to take like a week-long course. I didn't have the money to drop 30 to 50K on an implant course. So the next best thing was, okay, let me ask my mentors what books they read and what literature they read, and they kind of just gave me a heaping list, and they're like, all right, that's what you need to know. I'm like, okay. And so that's really where I started getting my training from, the didactic knowledge. Um, and really anyone can open a flap and put a screw in a bone. I mean, if you've ever done any kind of put furniture together, you know how to do that. But in order to place a screw into someone's body and have that, in a harmonious way with the prosthetics and the soft tissues in a long lasting way, it takes a lot more didactic knowledge. And so, that married with fundamentals in surgery is really what's important. I actually haven't needed to take any kind of live implant training course just because of my experience in my comfortability with surgery. However, I highly suggest people do that, right? Like I highly suggest them get some fundamental basic training in didactics with something like the Nachos program or the plethora of other information out there, and then get a mentor that can look over their shoulder and make sure they're doing the right thing. And then when you get to a comfortable point, then you can start pushing that bar more comfortably.
Love
So
that
yeah,
share.
in
And
terms of
I just want to add in, it's key to just hear so many different voices in your journey. My team is sharing our Nacho On Demand C platform. You can text Supreme to 215-543-6454. You literally can put Dr. Rob Slough in your ear for 5 hours. You can put Dr. Tahir Dune in your ear for 2 hours. You can put Dr. Carl Kroner in your ear for extractions for 2 hours. And then also what Sean is sharing, get books. There's no such thing as learning too many good things about something you do every day. I think what's key, Sean, because you have such a unique journey here, and Tyler, you're not doing anything else but this. So how does that really lend itself to just kind of continuing to become an expert in this, continuing to focus on this? Because you're not really distracted by other types of dentistry.
Yeah, no, that's a huge part of it, right? Like, I mean, I will always say being a general dentist, a good general dentist is very, very hard. And being comprehensive dentist is very hard because you have to know, if you're doing molar, endo, and ortho and all these, like, hopefully you're doing them at a very decently high level. And to do that, I mean, I can only imagine how hard that is if I'm just trying to focus that in one area, which is that of dental alveolar surgery,
One
even
of
though it's
my
a wide area.
one of my mentors who taught me implants, Dr. William Stewart, I didn't understand this when I was a young, energetic, mentally flexible guy. He goes, one day it's going to be very hard to keep changing gears. Because I said, I want to be a super GP, Dr. Stewart. I want to do crown lengthening. Then I want to turn around and do root canal. Then I want to do 3 implants because I'm just like a super resident, right? And he's like, that's going to be very hard one day. And he's 100% right. I mean, switching gears as a general dentist from a class 2 composite to a movable partial denture to 3 crowns, it's very difficult. And if you're going to do general dentistry, it's why it's key to hone those skills, because I think when you sub focus like you have, it lends yourself. Like, I only do this small thing here and I know how to troubleshoot this small thing here. Someone's like, hey, I need a class 2 composite. You're like, hey, you can see a dentist down the street for that. So I imagine, I'm just thinking, I was talking, Sean, as you grow this, you are going to need to develop relationships with dentists in the area, because I'm assuming your patients might come to you with other dentistry, might not be ready for the all-on-X case. Will you be referring to them or in your area?
Yeah, and honestly, that's part of the conversation to have with some. I've already had some patients in the 3 short months that we've been open where they come to me. I'm like, hey, it's not time for you yet. And that's kind of what spurred me on to want to go around the community. Planning on doing that in the new year, just with how busy the office has been. But I want to find someone that can do good work. That I know will. It's almost like, I mean, it's just like when you're looking for specialists. You want someone that treats your patients well when they go in, they have a good experience, and then also that they're getting good work. And they won't be frustrated like that's why they came here, because they're frustrated with dentistry. They want it all gone. And I have to tell them, hey, maybe it's not time. Maybe it's better
Yeah.
to, give dentistry a second chance and try to find someone good.
I
So
encourage you
yeah.
this. I mean, you got a lot on your plate, but Rob and I are doing this in February. So we're paying for it. I actually been getting Nobel to sponsor, part of it, but like, it's going to be 6 to 8. It's a free C course for dentists in our area. Their teams can come, and we're going to talk about the benefits of fixed and removable implant cases so that they can treatment plan them and know what they are. And those things can just be game changers for you, Sean. You should run one when you have the bandwidth and the time. Just invite like 12 dentists to a restaurant, run a CE course, treat and make it all about treatment planning. Not every dentist actually out there wants to do this stuff, but just like you talk about your GPR, it's nice to know about the treatment plans. It's nice to be more knowledgeable when your patients talk to you about it, right? What are there's dramatically different reasons to have fixed first removable implant cases. And I encourage you to do that. Let's get into this financing. Patient comes in, they say, hey, Dr. Sean, this is great. I like it. This thing cost $60,000. I'm just using that. I don't touch your fees. How do I pay for it? What's your guys' answer to that? How do you get people to understand how they can pay for it?
Right. I mean, it's difficult, right? Because we don't have an insurance system that's like medical. In dental insurance, I don't think is like insurance at all. That's a separate issue. But yeah, we are fee for service, so it's very normal for patients to have financing, and that's something I try to communicate them to people about, because some people are hesitant about owing money. And I'm like, listen, I couldn't even go off the street right now and buy a $40,000 car. There's no way. I had to finance it. Um, and so when you present a $40,000 treatment plan to them, if they need a double arch in terms of a couple $100s a month, it becomes a lot more, bite size that they can consider. And so, yeah, we do use some third party options. I think currently we're using Proceed and Care Credit,
Cool.
and those are the main two options that we use. And then of course there's other options like home equity loans and stuff like that. My team lead, she's amazing at talking to your
So
patients
I
and
was
making
going to say,
those.
so mainly one of the things I share is I know how to do every job in the office, but I pass the jobs off because many times patients see the office team members very different than you. They see us as like the weird dentist person. So I have a Kate who talks to them. So you have a team lead, you bring someone in and says, hey, what's their name?
Michelle.
Michelle's going to talk to you about how to pay for this, right? So you get to pass
Mhm.
that to her. And
Yeah.
I would say, there's a famous Super Bowl game. I don't know if you saw it, where the Seahawks basically gave the game to the Patriots because they threw the ball on the 1 yard line when they should have handed it off to Marshawn Lynch, right? So one of the things is when you hand something off, the person has to do it. But I really admire that system. I use it because it's key. I see people in the chat here too. Please feel free to ask questions you have about implants, AGD, shared practices. I see Stephen in here, which is awesome as well. So the payment part, I mean, I'm just reinforcing things, and I've been doing this my whole career. I just say to people, if you talk to people like people, magic happens, right? So I just say, even before I bring my Kate in, I'll just say, hey, Sean, this costs like, let's say it's $60,000. Would you want to pay up front and get a discount or stretch it out over time? And then I just shut my mouth. And someone in that moment, they're going to tell you exactly how they feel. And many people have saved up for this and they want to pay it all at once. And we offer a 5% courtesy for payment in full. And then many people, like you talked about, would prefer to stretch it out over time. But it's very important to master the payment part of it. One of my biggest gripes about dental school is that they do not talk enough about money. And when you get out, it's all about money, right? Nothing can happen
Yeah.
unless the patient can pay for it. Unless you are giving charitable dental care away, which we do, they've got to understand how to pay for it. And dentistry can be very, very confusing. I mean, what do you guys say? I'll tell you what I say, but let's say someone says, I like this, Sean, this is great. Dr. Sean, I'm going to do this, but I have a spoiled guac PPO dental insurance. What's my insurance going to cover? How do you guys handle that?
I mean, we just tell them, hey, like this is a pretty comprehensive type of treatment that, and the insurance companies don't view it as something that's necessary. They view it as cosmetic, which we think is kind of crazy. And so, and patients usually agree. They're like, yeah, this is definitely. I mean, I can't eat. I'm getting depressed because of that. It's definitely not just because I want to look pretty. And so the conversation kind of steers towards, well, insurance is the problem, and most, patients tend to agree.
Yeah.
And I always bring up the example of Massachusetts where they passed that law recently where insurances need to use at least 81 or 82% of the patient premiums to
Yeah.
pay back for care. And I'm like, hey, that's a good state to look at. Write your Georgia, or write your state legislators and pressure them to do something like this, because until something like that happens, that's insurance is never going to pay for something like this.
Yeah, I always just say insurance is like a coupon. We're going to use the best job possible, maximize the benefit of your coupon. In cases like this, don't expect it to take care of a lot, but there could be something that helps with early on, like your extractions. And, then you just immediately have to have them understand that this is not like paying for a crown, where insurance can be a significant help. It's paying for something that's transformed them. So we're going to wrap up in a couple of minutes, Sean, but I want to ask you, did I miss anything in your journey that you wanted to share? I mean, you did a great job taking us from your whole circle of dentisting life. You've done a lot in these three years, right? Total since dental school?
3 years, yeah,
3.5, and year 4.
went by quick.
Yeah. You kind of have already shared, most dentists learn this, the people part's harder than the procedure part, right?
Yeah.
It's how to place 6 implants and connect a denture to it, or remove a tooth and do bone grafting, but figuring out the patient part and the team part's challenging. If somebody was a new dentist, and let's say they didn't do any Air Force training, any AGD, they're 2 years out and they say, hey, Dr. Sean, I want to get started on the journey to dental implants, what would you kind of recommend they do?
I would definitely recommend them, reach out. I mean, always reach out to me, and there's I'm not unique in any sense that I feel like there's more and more people like me, younger guys and gals that are getting after it, and doing it in a responsible way. So reach out to people like that. Reach out and ask, exactly this discussion, which I'm glad that you're having me on for. That's how I got into it. I reached out to Dr. Mataria on Instagram. Great account to follow. He's a GP that's doing implants at a very high level. And he straight up gave me a list of books to read. And I was like, wow, okay, if my specialists are telling me to read books and this guy who's also doing it at a high level is telling me to read, then I should probably do that. So reading is huge. Getting the proper training is huge. Knowing your limits is huge. And if anyone has questions about that, I'd be happy to answer them.
I'm going to
I
bring
guess
yours
one
up here. And
thing,
those are, oh, keep going. Sorry. Keep going.
yeah,
Thanks.
oh yeah. I mean, if there's one thing I want to say, I think is don't keep up with the Dr. Joneses, and what I mean by that is I feel like nowadays, especially, I mean, I see it on job apps all the time. Is oh, you have to do an AGD or GPR to do this or that. I would say don't feel pressured to do X, Y, or Z just because it seems to be the trend, or that I might be behind if I don't place implants, or I might be behind if I don't do molar endo. I'd say that's where you can get into trouble. I only pursue the things that you really have a passion for. When I picked up a book, my first book, I read Dr. Michael Picos's book. I had no issues reading it. I didn't fall asleep a single time, and I was like, "Wow, this was like drinking water. It was so easy." If you find something like that in dentistry and you have that kind of reaction, then that's probably something that you have a natural passion for. But if you're like clawing just to get through the first chapter or something, that's probably something that you don't want to force yourself to do. Because if you aren't truly passionate about something and learning how to do it right, not if complications occur, you'll get scared and you'll run away and you'll never do it again. Versus, you know, when you're doing implants and you have your first complication, you'd be like, okay, I expected this. This is supposed to happen, and I'm gonna learn how to get better at it and keep doing it. And so yeah, that would be my biggest thing.
I love
Don't
that advice. I'll just add to it as maybe the medium age dentist here that first, awesome advice. You can't, no matter how much money you make, you can't hate what you do every day. You just can't. So no matter how much money I might be able to make doing molar endo, if I didn't like it, I'm not going to want to keep doing it. So I love your guidance on that. One thing I'll share though too is you don't really know what you're going to like or not like. Taste test certain things. Gary Vee's a big fan. I'm a big fan of Gary Vee, and he says even with your kids, taste test certain things. Don't judge as it's D2 that you hate implants and you love ortho. Just taste test things. And while Sean is 100% right and create your own journey, the GPR AGD time gives you this opportunity to taste test things in a very comfortable way. Where you said you had co-residents who loved ortho and didn't like extractions. You had co-residents that liked implants and didn't like endo. So it just taste test things during your career. If you want to watch this recording again, you can text recording to 215-543-6454. You'll get this recording and other ones that you can watch if you want to go back and hear some of Sean's awesomeness again. Sean, you have your info here. Tell our audience how they can connect with you.
Yeah, best way to reach out to me is my Instagram at Dr. Sean Land. You could also email me like Dr. Goodman has up here, and yeah, let's get connected. And I'd be happy to get on a phone call with you or email you back.
Awesome, Sean. Well, you did a great job. I'm going to take us off Facebook Live in a second. I just want to share, we do have an upcoming Crown show. Just text Crown to 215-543-6454. I'm going to take us off Facebook Live. See you guys later, Nacho Facebook Live crew. Awesome, Sean. Stick around. You did an awesome job. That was great. We still have some Zoom people here. I saw Steven in here for a period of time. So you had your mentor there checking you out. Where's he located? What state's he in?
He's in California, Santa Barbara.
Oh, cool. How many of these implant centers are there? The denture centers are there total?
Currently, I think we're over 35, approaching 40.
Yeah, that really is. And it's kind of one dentist per location?
Yeah, right now it's one dentist per location, and then once it grows a certain size, the goal is to get an associate in there. So,
and we had a couple of questions from the people. You're placing 15 to 20 implants a month. Do you have a goal per month that you set for yourself? Someone asked.
I mean, not necessarily. I mean, as long as the more patients we treat, the more I'm gonna inevitably do. So I don't really like put a number on that myself. What I'm really focusing on is what kind of cases I'm taking. So if you use the ITI, they have a classification, the SAC, simple,
Yeah, yeah.
advanced, and
Been around for a
complex.
long time.
Yeah, I keep track of those. Doing 10 simple is great, but it's really not going to push the envelope as far as, doing more complicated cases. So it's just really about how many, for me, the cases I keep track are the cases that are pushing my envelope. And I write notes about it. I have like a little, almost like a diary about them.
Yeah.
And I write down my learning points and stuff like that. And sometimes I'll share the case on Instagram too. But I think keeping a private diary like that as well, or something that you can share with your mentor, which you should have, is pretty invaluable too. So I don't really keep track of, I don't have a goal of how many single implants I'm doing.
And one of the things I can, just share sometimes, many of these consults, they don't always move forward the first day, but their teeth don't magically grow back. So you'll see you're only 3 months into this journey. You'll see someone that you did a consult on return. That's happened to me. So the more you're sharing, and I encourage you to do that local C course, or, listen, you don't even have to do a local C course, just like do like a local like happy hour thing where you just say, hey, let's come and talk about implants. You'll be shocked at how many dentists like that. My best piece of advice though is invite their team. Say, oh, do you have like an office manager who would like to come? Do you have a hygienist? Because those other offices, the dentist is busy, but it could be the hygienist who says, oh yeah, that guy Dr. Sean does this. It might be the front desk person that says, oh, Dr. Sean does that. So I think that's a great like local good vibe thing to
No, that's
do.
good advice. Yeah, I really want to do that. I read this book, or I'm in the process of reading this book called The 2 Hour Cocktail Party. And it's a guy, he really, I mean, just like this, he's like how to have it efficient, like during the way. It's 2 hours, it has a purpose, but it still feels like loose enough for you to connect and
Yeah.
stuff with people. But yeah, I'm looking at implementing something like that soon.
Yeah, and
Just to get to know people. So that's
sometimes only
good
four
advice.
people show up. I mean, them knowing you do something in their proverbial backyard, it's very, very key. Because here's the thing that I can share with you. It's like, we do Job Connect, and people come from the internet and just post a job, and people come from I know. But when we get like a trusted resource to refer them, there's like 100% case acceptance. So when their accountant says to the dentist, Paul Goodman does Dentist Job Connect, put your ad on his site, 100% case acceptance, right? So when
Yeah.
you have a dentist in your town saying, oh, Dr. Sean does this, I don't do this, you should see him, it's not going to be 100%, but it's such, do you see, it's a very different feel because they got recommended from a dentist. They didn't see a Facebook ad. So build those relationships because they're so key. And we have some of those in our community. You just need the ones who don't think you're going to steal their patient and stuff like that. You just got to be very, you just have to constantly clarify. You have no interest in doing their crown on number 15. You're not
Yeah.
going to do their veneers. So
Yeah. Yeah.
awesome. So well, you got to come to Philly sometime and see us. This was great. I'll let you go back to hanging with your family. Everyone else here on Zoom, thanks for spending time with us, and catch our next show coming up. Really appreciate it, Sean.
Listen, I appreciate you having me on.